Hey, let's make welcome Dr. Klein, Dr. David Klein of the Stages of Life in Longwood. A really nice drive from up in this area, the villages and all the country club communities, and you can make it up there in just a little over 1 hour. But you'll be glad you did. You'll have the nutraceutical store. You got a great doctor, and of course, you've got all the support staff, and it's just like family, okay? Just off of I-4, so it's really easy to get to. Today, we're going to talk about headaches, because everybody out there that's listening right now has often complained of a headache, and some worse than others. So, doctor, what causes a headache?
Okay, well, the first thing we need to understand, is that the most common presentation, the most common diagnosis of headache that comes to my office, either as a referral or as a walk-in, is misdiagnosis. Okay, people like to throw labels at headaches without really knowing what they're doing. They don't get it, don't seem to care. And the one thing that seems to pull its way through all of this is that if you don't know what you're dealing with and you don't make the diagnosis appropriate, nothing is going to fix it. You can go from one triptan to the next, and it's not going to make any difference if the problem is not truly migraine. You can go from one headache medication of a sinus type to the next. If the problem isn't sinus, it doesn't make any difference. So I had this gentleman come in, and this happens maybe 2 or 3 times a year, with chronic headache, and it bothered him towards the end of the day. Okay, he didn't awaken with a headache, but it bothered him towards the end of the day, and it always was pain behind the eyes. So I'm sitting there looking at this guy, and he's talking to me, and I ask him, well, do you have any problems sleeping at night? No. Do you wake up in the middle of the night? No. Do you have any pain in your back? No. And I look at him, I said, how well do you do when you don't wear your eyeglasses? He goes, well, I have to wear my eyeglasses or I can't see. I said, when was the last time somebody actually properly fitted you for those eyeglasses? But it's not what you think. Okay, this wasn't a matter of refraction. It was a matter that the arms of the eyeglasses were cutting into the side of his head, okay, thereby irritating the nerve called the auriculotemporal, causing a disorder called trigeminal neuralgia, which hurts like a son of a gun. This is one miserable headache, but it was being caused by lousy eyeglasses. I said, do you not feel those grooves cut into the side of your head? I said, I can see them. I said, you have got to be able to feel them. He goes, well, it's funny you should say that, because I was wondering what those are all about. They're like train tracks, okay, one on each side of the head. Okay, so a mechanical headache, very easily treated. What you do is you don't go buy your reading glasses off the shelf. You have an optician, a properly trained optician, measure and fit you properly for these eyeglasses. If the arms of your eyeglasses angle and cut into the side of the head, you are going to develop something called trigeminal neuralgia. Well, migraine is not just severe headache. Migraine doesn't mean severe. You can have migraine headaches and have no pain whatsoever. Okay, acephalgic migraine, no headache migraine. Well, why? Because migraine is a vascular illness, not a neural illness necessarily, and it's treated by using vascular active agents. So you can have terrible, terrible headaches, which may or may not be responding to these triptans, which may not be migraine at all. The most common of all, misdiagnosis. You can end up with a sinusitis of the ethmoid, sphenoid, the frontal sinuses even, maxillary sinus, far more common, but mastoid sinus, oddly enough, can become infected and inflamed and cause terrible headaches that have and mimic migraine, they mimic occipital neuralgia, they mimic all manners of things. Now, so what else could we possibly talk about that you haven't already heard? Because everybody knows everything about headaches. Well, if you're over the age of 60, okay, and some of the listeners are actually over the age of 60, and they are also likely at some point in their age to develop something called Paget's disease. Now, the Paget's disease is like having a wart of the skull. Okay, it happens in the long bones, it happens elsewhere, but these osteoma, okay, will cause headache. How do you find them? Simple skull x-ray, believe it or not. Looking for it, you will find it. And oddly, these types of headaches can be miserable, but they are easily treated, either topically or through injection. Okay, but Paget's disease, for God's sake, gets missed all the time. All right, so what else? Okay, so we've got sinus, mastoid sinus being the one that used to be years ago be a very, very common surgery that would do. But maxillary sinus causes headaches in lots and lots of folks. Trigeminal neuralgia. What is trigeminal neuralgia? Well, trigeminal neuralgia is simply nerve pain involving the trigeminal or fifth cranial nerve. There are 3 branches. One goes up the side of the head. It has a lesser division that goes into the mandible, one that goes over the eye, and one that comes out under the eye. Trauma is the most common cause of trigeminal neuralgia, whether it's blunt trauma, whether it's surgical trauma from oral surgery. So motor vehicle can do it, oral surgery can do it. You can develop trigeminal neuralgia from infection. You can also get it from grinding the teeth. So you think you have temporomandibular joint disorder, or TMD, when in fact it may well be trigeminal neuralgia. So how do you separate this out? Well, the most common of all the TN problems, okay, are can manifest with tenderness just in front of the earlobe. So if you put a little bit of pressure along the angle of the mandible, that's the bone that you chew with, okay, just in front of the earlobe, if it causes exquisite pain at that point, that's the 3rd division of the trigeminal nerve. If you find yourself wanting to dig in your ear because it feels like there's something crawling in it, itching in it, there's this, they're called the tragal division of the 3rd division will cause this. If you have pain over the forehead, that's 1st division trigeminal neuralgia. What can cause this? Could have been an old injury. I had one poor guy who, honest to God, I promised this fellow I'd figure out what was wrong with him because I felt so sorry for him. He came in with black eyeglasses and a full beard. And I thought he was blind. So he came in, he was sitting down. I made a mistake. I said, okay, how long ago did you lose your eyesight? And he goes, well, I didn't lose my eyesight. I said, okay, tell me the rest of the joke here because somebody's goofing on me. He goes, no, you don't understand. I have to wear dark glasses like this because any light will make the facial pain worse. Okay, and so I said, really? Well, what happened? And he was telling me this guy was a stockbroker in New York, and he was crossing Wall Street, of all places, and it struck him like a bolt of lightning and hadn't been able to work since. That was 20 years. And it was the 3rd division trigeminal. He was unable to shave because any touch of the skin, razor, any vibration drove him nuts. So I thought this guy was blind, okay, because of his appearance. I thought that he was a creep because he came in looking like a mountain man. As it turns out, he was a stockbroker and a creep. But, okay, but it was treatable. And what had happened to this poor guy was that he was struck in the face by a softball 5 or 6 years prior to that, broke a little tiny piece of bone in the zygoma. It calcified over, pinching the 2nd division, causing his pain. So getting this thing fixed was a simple matter of surgery, very easy surgery for the surgeon, actually. I couldn't have done it. Maybe one day I would have, but I didn't at this point. So I sent him to a buddy, took care of the guy's headache. Okay, and I don't know if he ever went back to being a stockbroker or not. Maybe he got a conscience in the interim.
Wow. All right, so what is an actual headache? Is it nerves in the brain that are causing problems? Is it brain cells dying? Is it too much alcohol? I mean, when people have that pain in their head, where's that pain really coming from?
Well, okay, your head, okay, is about 1/9 of your body surface area, okay? So it could be bone, TM joint, okay? It could be bone, let's say, from Paget's disease, or let's say it could be bone called a tooth will cause headache, right? Okay. Could be muscular, masseter, for bruxism, you're grinding your teeth. Could be nerve, trigeminal neuralgia. Could be meningeal, meningitis. It could be tumor, brain tissue. Could be sinus. In other words, it can come from anywhere because the head can hurt. Okay, but there are many different structures and tissue types in there that can cause pain. You can develop pain from toxic causes like a hangover. Okay, you can develop headache from medications. You can develop headache from not sleeping enough. You can develop headache from barometric changes, barotitis media. Okay, there are lots and lots of causes of headache, but where does the pain come from? Okay, the pain typically and most commonly comes from either nerve irritation or periosteal irritation. The periosteum is the membrane that surrounds the bone and surrounds the teeth. Now, the periosteum also surrounds the sinuses, believe it or not. Okay, so when you end up with a sinusitis, the inflammation causes pain that is moderated and mediated through the periosteum, which is why most of these headache medications contain something called NSAIDs, non-steroidal anti-inflammatories, which moderate minimize and often eliminate your headache whatsoever. But in order for you to treat the problem, the take-home message here, the take-home message is you got to figure out what's wrong. The prime directive, okay, the mission that must be accomplished is to find out what the heck is causing it to begin with. Because if you don't, it serves no function. You can treat a headache with analgesics. You can give somebody heroin, for God's sake, it'll block the headache. Okay? But if somebody has Paget's disease, okay, what do you use? Use an anti-inflammatory topically, and you might end up having to burn it a little bit with some phenol to take care of it altogether.
All right. And there's probably something right there in the nutraceutical store that would help you with that headache. Let's check it out.
All right, come on in. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. Our phone number is 407-679-3337, and our website is stagesoflife.net. The office hours are Monday through Thursday, 8 to 5. The health store is open during those office hours. You are invited to come on in and look around. And there's always somebody in there that can help you out with those nutraceuticals. And we are also on Facebook at Stages of Life Medical Institute.